Hello, hello. Can you hear me? Looks like you're just joining in. Hello. How are you, Brennan?
What's up, man? How's it going?
Good, good, good. Not much at all. Busy day at school, but same old, same old. Then I hear the same for you. You just came off of that trivia. How'd that go?
Yeah, good, good. I always like to participate because it's like the only way you learn anything. So no,
Yeah,
it's good. I had a
yeah,
mentoring session with Harvard OMFS interest group, and then I had a call before that with a D3 at NYU. But I love to do it. It's just I think
yeah,
sometimes we got to find some time for ourselves.
yeah. Another day in paradise, but for sure
Yeah,
busy.
how you
Yeah,
doing?
no,
How's your day?
absolutely. It was good. The day started off with 8 a.m. sim sessions, which are always hard to get up for. But 8 a.m. to 10:15, we had a sim session, and then after that, we had like a few lectures to study for and a quiz later on in the evening, and then an undergraduate dental education committee. So like where we review different courses and stuff, and we get to vote on if we want them to continue or whatnot. And then some more memorizing and studying, and then another a removable pros course. 30 minutes after that, we had sim till 9, and now I'm talking to you. So same thing, man. Like busy, but also the reason why we're doing it. Like I love it. I love it
Right?
so
It's
much.
fun. It's fun, dude. We get to chat like
Yeah.
this. We never would
Yeah.
have met.
Exactly.
Think about it. Like no.
Yeah. Yeah.
So because this is
Yeah.
technically our part
Now,
two, so that's pretty sweet.
yeah. Yeah. I have a little intro here now, and I know this is a little bit different, but just so everyone knows, I kind of got introduced to this whole game of podcasting and also just really taking a dive into social media through Dr. Gallagher here, who has been like just an insane mentor to not only me, but through his pre-dental mentorship map. I'm sure most of you know him, but I'll go ahead and jump in with this new podcast that I'm introducing. So, welcome to Moony Talks, the number one podcast in the world, according to my mom, and a place where we're going to hopefully dive into dentistry, health, and everything in between. So, if you're new here, please hit the follow so you don't miss a new episode every other week. And if you've been following for a while, first of all, thank you. And second of all, share it with a friend, classmate, or whoever needs a little bit of inspiration today. So, let's jump in. Today's guest just doesn't just wear many hats, he wears them all at once. Oral maxillofacial surgeon, a mentor, content creator, podcast host, and the mind behind the pre-dental map. Give it up for Dr. Brendan Gallagher. So I just want to make sure I get your kudos so that people can get a little introduction to you. But let's start from the beginning, Dr. Gallagher. Why dentistry? What drew you to dentistry? What drew you to OMFS? Why not medicine? Was there a moment that made you realize, yeah, this is what I'm meant to do? And I know your story, but I want to make sure everyone who hears this podcast knows it as well.
Yeah, yeah, and also, well, first, thanks for having me on and picking me as the first
Yeah,
guest. That I mean, that really means so much to me. I don't think you know, like that really means in my heart. Thank you. And then number
yeah,
two, kudos to you, dude. I told you, you got to take a step, just go for it, and you're doing it. I love that. I love that. So I like
there
to
we
see you
go.
following through with these things. I would say, dentistry. We all have a path through high school, college. We're trying to figure out what we're gonna do, what we want to do, how we're gonna make money, how we're gonna support a family and stuff, right? And through dental school, I was just trying to aim for a pre-med, pre-health path, whether it was going to be med
Hmm.
school or PA school or dental school or something along the, treating patients path. And I was about to start studying to take the MCAT, and I met a couple dentists at my gym. They called them the men in black. They would go there at 5 a.m. I would see them when they were
Yeah,
leaving and they already finished their hour and a half workout. I would see them at like 6:30. And so someone told me to go up to them one day. It was it was right before my second year of undergrad, and I was about to take organic chemistry. And so one of my friend's moms, she was like, "Oh, you gotta go talk to Mario and Nick, and then those guys. They're dentists. They all got
yeah,
A's in organic." And I was like, "Okay, let's talk." So I get to talk with them, and then I go and shadow them in their offices over the next couple of years, and then finally going to my last year of college, I was gonna take the MCAT, and they're like, "Just come, come see what we do, whatever." Shadowing, and then I was like, you know what? Forget this MCAT. I really like the lifestyles that
yeah.
they live. I love how motivating they are. They were all so happy and like welcoming. They're living their lives. They all have families. They all own their own practices. And I was like, this is the life I can see myself living. I want to help others the way they helped me over years, right? And so I made the complete switch. I had to take a gap year, but you know what? I'm so glad
Hmm.
for taking the gap year. You get to learn a lot about yourself. You got to learn about the world that we're living in here, because it's not all
Yeah,
classes and tests in school. And so took
yeah,
the DAT right after I graduated, applied, got my interviews, got into dental school, and off to the races from there. I worked for
yeah,
there was an oral surgeon and two general dentists. I worked for the oral surgeon in my gap year, and then when I went into dental school, I was like, so I know what general dentistry is for the most part, and then oral surgery for the most
hmm,
part. There's so much we still have to learn, right? But I was like, let's see what else there is. And I have a foundation, go from there. And took the CBSE externships, went into residency, did oral surgery residency at NYU Bellevue, and then now I'm out here in private practice on Long Island in New York, and just studying for boards and doing the
Living the
next
dream.
thing. So
Yeah, yeah, no, absolutely. And I just speaking on to the gap year thing, I know so many pre-dentals when they come up to me, they're asking about they're not sure what's happening, like maybe their school's requirements changed. Every single person that I know in my dental school, my older sister who took a gap year, they are 100% more confident in the decision they made once they're there. Like I can't explain it enough. So I know if you're a pre-dental and you're watching, you're worried, man, like I don't know exactly if I'm going to be able to qualify for the cycle. Trust me, it's a marathon. Like you're seeing like, one of the greatest to ever do it, tell you right now that he took a gap year, and it's something that 100% I know it's hard to hear, right now, but trust me, on the other side, you'll realize how fulfilling and worthwhile it was. But now I also want to pick up on something you said. So you took the CBSE. Now, this is the STEPIC exam and the Achilles heel for so many ambitious students who want to do OMFS or whatever it may be. So between like a heavy course load and long clinic hours and just trying to have a life, like it's already a lot, right? So you went through it, you survived and clearly came out stronger. So what are three things you'd say to somebody studying for that step one right now?
yeah, studying for that exam, it's no walk in the park, that's for sure. I still think that that was harder than some of the other exams that I've taken in residency. At the end of residency, some board exams. That was one of the top 3 hardest exams I think you take, and it takes a lot of time. It's one thing is like you're studying for dental school, you're seeing patients, you're in clinic, you're in sim lab, and then you start studying for this, and it's so much different from any exam that you take in dental school. I mean, it helps if you have a combined med school curriculum, but it's still different, right? And then you're trying to find the time to study for this different exam. And it there's really no way. You just have to muscle through it. It's one of those exams. It's like you have to say goodbye on weekends. You got to go study. It's like you put in 15 hours at the library, or I was at Panera Bread on weekends studying for that thing. And it's like people ask, how do you do that on top of school? You have to get up earlier and studying before you get in. You got to stay up later and study after you go in, right? It's because you can't study while you're at school all the time. It's got to be around your outside hours. Unfortunately, it's just a muscle
Mhm.
through thing. Yeah, and
Yeah.
learning from my mistakes, I also hooked up with this guy, Brandon Axelrod. He's a resident at Cornell in the city now, and we made this video called CBSE Dissection. We're not getting money for this or
Mhm.
anything. It is so
Yeah.
helpful for people studying for that CBSE. I've got a lot of feedback from
Yeah.
people saying that it's helped them on their second and third times taking it. So if anyone's listening to this, they want some help on that CBSE, I'm telling you that we did made it to help, but we've gotten feedback that it's actually helped. So that's if someone needs it, it's there.
That's it. Yeah, 100%. Like, and I know just speaking like for those watching, like the pre-dental map, for example, that's just something I have more experience with. In terms of the pre-dentals who've come up to me, and I've been like, listen, I don't have too much time to help right now. It's second year, super busy. Check out this pre-dental map, and then I see them a week later, and they're like, thank you so much. It took my stress off. And from what I understand, that's another one of the things that you started, and is it's not a paid thing. It's just one of those things that you just do because you knew you needed it back in the day, and so now you're like, you know what? Why not? I'm in this position. Like, let's try to help out these pre-dentals.
Yeah, man, that's exactly what it is. My buddy in dental school, Sean, he's an orthodontist now. Sean Czar here in New York in Great Neck, and we made that exactly for that. We're hoping to get it going, but we're not trying to take money from students. From
Yeah.
that's like the lion preying on the little calf. Like, no, come on, we got to
Yeah.
prey on other
Yeah.
lion, like quote unquote. Not I'm not
Yeah.
preying
Yeah.
on it,
Yeah.
but
Yeah.
like
No, of course. Of
we
course.
gotta stop taking money from the pre-dental students, the undergraduate students, the dental students. Like, we gotta start to strive and make this profession forward a little bit, make it a little
Yeah.
brighter going
Yeah.
forward. So that's the goal with that. And yeah, if we could get sponsorships and stuff, it's great. But the whole idea is to build it up to make
Mhm.
it give back more, not to take from. So yeah, you
Of course.
get it.
Yeah. So now going to residency, because now you did dental school, like most other DDSs or DMDs, but then you had this whole other arc of your educational career where you went into this residency. Now tell me about residency. Like, how was that whole experience? Were there any super memorable moments, any learning lessons, any things that you're like, if I could go back, I definitely wouldn't have done that? Or even with the CBSE, like if you could retake that, what would you do differently?
Ooh, well, right there is taking the CBSE doing differently. I would have started probably earlier if you can. You have 6 tries to take it. Take it as many times as you can to learn about it, and then study for as long as you can. Once you get dental school down, I wouldn't try to start studying for the CBSE until you can manage classes, which is they say an average of 32 credits a semester. Right? You got to get classes down and clinics, sim lab, clinic, seeing patients. You got to manage those too because you need to graduate dental school before you become a specialist. You need to be a
Of
dentist first,
course.
right? So get those down, and then you add on studying for the CBSE. The materials are out there, you can do it, but you have to it's really good to prioritize certain things you need to do first before you add on too much on your plate for you to swallow, right? Residency, oh
Mhm.
man, there were so many I mean, we could go down some rabbit holes if you want, but, I would say one of the things is it actually morphed through the years because post call is a day where after you spend a full 24 hours on call, just awake, treating patients, suturing up their faces from whatever it may be, it actually goes to like 27 hours. But legally, you're supposed to get that next full day off until you go back like 12, a little less than 24 hours after that. And my first year residency, we didn't have that rule. Uh, there were some 30 plus, 35 plus hour weekdays where you're going for like two days straight and or longer
It's
sometimes.
insane.
And yeah, I wouldn't recommend it. I wouldn't do it, but there are some programs out there in the country that like that's the norm. And luckily, there's many residencies, probably most residencies, do abide by it. But like, it's that's one thing to consider. And you could be
Mhm.
working with one eye open, but it's like if you think about it from the patient's perspective, this is still their moment that they need help, and it's like why do we put people through this to have them stay up a couple days in a row? And it's like this is still this patient's
Yeah.
moment, and so that's an interesting thing that I think of them.
Yeah, yeah. Absolutely, and it's something that I definitely wouldn't have considered, and it's you hear about it, you hear about the difficulties of residency and, like, how grueling it really can be, but, like, that anecdote in itself can just show everybody, like, what it takes and also how we can maybe adjust, the whole process, but I wanna pick up on our last interview, so, like I spoke to earlier, we have talked before, and I remember you asked me what residency programs are at London in London,
Yeah, yeah.
Ontario, and geez, did I get flack for not knowing them. So I wrote
Did
these
you
down, so I
really?
wanna make sure I get them off you. Well, I didn't I was like, "Listen," I'm still trying to I was like the funniest thing was I was talking to you like, "Man, I wanna know if I wanna specialize or not." At the same time, I didn't even know what specialty programs were offered at my school, and so, like, it was just like one of those, like, "Okay, you're so naive and young, and there's so much to this." But it was a funny moment between me and my, class and the admin at my school, but so here it is, just so everybody knows, and just to
You're
clear the
there.
air. So there's orthodontics and, dental facial orthopedics, so ortho, oral and maxillofacial surgery, so for those that's exactly what Dr. Gallagher done as well. And then general practice residencies or GPR, which is oftentimes what people will do before, like an OMFS, for example, to just boost their application or whatever it may be, or also just to kind of reinforce their skills for those who haven't heard of a GPR. And then a few others, and so those are the ones that the Schulich School of Medicine dentistry, not perio, not a few others. But then speaking to that again, not having those specialty programs in house also helps the main clinic a lot because we're able to see those cases. So at another school, when they do have the specialty programs, you might defer those cases off, which is so it's pretty nice that we have like a really niche subset. But yeah, I'm glad I got that out of the way. I want to get back to something you touched on earlier in the
Real
meeting.
quick, what did people really give you flack for
Yeah,
that?
not like it was playful. I know. Yeah. Yeah, no, no, and it was like it was just one of those things where it's like, geez, we really I was saying like, I don't know if I want to specialize. I don't know like if I can figure out. And they were all like, we know, yeah, we know. It's just and it's about asking these questions, having those conversations.
Yeah.
And if we didn't have that conversation, I wouldn't have found out what specialty programs are at Western. Hopefully, not everyone
Yeah.
watching knows it.
I
But
got
now
a second
speaking
question too.
to
What's something that you
yeah,
didn't
yeah, yeah,
expect during your first year, for example, or up until now, right? That you didn't
yeah,
anticipate going in? What was an eye opener? What was a shocker for you in your time so far in dental school?
man, one for sure. And this one just jumps to my head because every single time I remind myself, like, okay, you've trained your entire undergraduate, all of college, all of high school, all of it's been leading up to get into this dental school. And you're coming in and you're like, that's it. I've finally done all the general sciences. I've finally done all of the things I need to do. I'm just going to learn teeth now. That's it. I'm just going to learn teeth. And I was so excited. And I was like, man, I'll never have to touch biochem again. This school's going to have it all figured out. And I was like, "This is great. I'm in paradise." And I am still in paradise, so I don't wanna discourage any pre-dentals applying, but yeah, but you have to I had to understand that just like any other school, this school is not perfect, right? There's things that fall through the cracks, and although I love my school and I wouldn't rather be anywhere else, there's also things that, like, for example, you're taught core bio, you're taught the biochems, you're reinforced with biomaterials. There's these different concepts that you wouldn't think relate to dentistry, but are really important foundational concepts that you need to know, which I definitely didn't appreciate in first year when I was taking them, but I 100% appreciate now in second year, knowing that, listen, I got to figure out which composite type I need to apply to this restoration versus this restoration, which like bevel technique or retentive factor I need to keep in mind when I'm doing this prep versus this prep. Things that like all connect, but if you don't take that first year seriously, it'll really affect you because once you get there in second year, it's just going to be something you memorize. And I'm not the memorizing guy. I'm the hopefully mind mapping and understanding it that way. So that's definitely something that was like a wake up call. And then it was like a, you know what, this is life though. This is how it's always been and it's how it's going to continue to be.
That's right. No, that's a great point. It is unexpected. You're like, finally, just teeth, just the mouth. We're going to learn bio and related to
Yeah.
the systems, the biosystem. And then you're like, wait a minute, why am I learning about like, like the type of composite that we haven't touched since
Yeah.
1955? What?
Exactly. Exactly. Oh my
All right,
gosh.
I'll take the a different leg on and I'll say we probably don't need to learn that anymore.
Yeah, 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 and I would agree with you on that one for sure, for sure. But for any D1 students, trust me, the admin, they put a lot of thought into this curriculum, so and they're always changing. So hopefully soon enough they'll get rid of that composite
Yeah,
lecture.
yeah.
In the meantime, they're just doing their thing, which is yeah, which is great. Dr. Brennan, tell me about opening your own clinic. That is insane, man. How much fun are you having? How busy is it? What is like kind of the biggest thing that you didn't expect when it came to this process, and how has it changed?
Yeah, so let me lay a picture here. So there's different things that you could do. You can sign a contract with an organization. You can open up a clinic from scratch. You can buy into something. You can just go and work in an institution. You can work in just a hospital. You can do clinic, hospital, and or you could just work at like a school too. So there's so many options that you can do. And the cool thing about oral surgery is that it's a bridge between medicine and dentistry. It is. It's oral
Yeah.
maxillopathology and surgery are the two ones that I would say are bridges. But so the practice that I'm in now, it's one of like 8 or 9 offices, but it's not a DSO. That was a really important thing that I couldn't have the heart to go
Mhm.
work in a DSO. It's not something that I don't want to be a cog in the wheel. I'm not trying to be part of this, of a big
Mhm.
system. I am part of a big system now.
Mhm.
There was only 6 offices when I signed here about a year and a half ago. But I graduated in June and then I started working here. I finally got my license in August and then started working in September. And the start is great. It's so much better than dental school. It's so much better than residency. That's hands down. You're actually getting paid to do work
Awesome.
now, so that's something to look forward to. But it's definitely a transition because when you finish whether it be residency or dental school, you finish with like the academic system, and now life hits. So starting to work again. Like that's great. It takes a week or two to get acclimated. How do you write your notes in this system? Like how do you work with your staff there? Learning how the front desk like kind of filters through patients through. But there's everything, and I'm sure people have go through this through times in residency and dental school. There's everything that happens in life outside of that. So like I'm still waiting on an anesthesia license so I can do sedations. I can only technically do local procedures right now. I'm working on getting a mortgage right now because I'm going to buy the house I'm working in. Then my fiance can move in and like we can finally live together for once. And what's another thing? Like the license took a couple months to get. I'm studying for boards right now. I got to take the board exam. So it's like that's in February, but it's hard to find time while still trying to travel and see family and friends on weekends. And so it's better. You have that time. But when life kind of hits everything at once, and everyone goes through this at some point in their life, right? Where things kind of just hit you all at once. Juggling to manage the time, commitment, and management. It's an interesting start, 'cause, and some people that
Mhm.
happens like a few years in. Say they start working at a place and then they leave, and at the same time they have a kid and they buy a house and they just got married, or whatever it is. Like, but I think it's definitely easier to do those things when you're outside of school than outside of residency than when you're in it, though. If that makes sense. But yeah, so it's good. It's different. It's great working. It's great to actually see patients and handle those responsibilities that you've been trained to do. So yeah, it's been great so far. Wait.
Can you hear me?
Yeah, yeah, there. Yep.
Oh, okay, you can hear me? Perfect,
Yeah,
okay.
you're good.
Yeah, I got a notification, but yeah, so because 'cause I've heard similar things about how crazy it gets and how fulfilling it is at the same time, and it's just like this second mountain that you're climbing. Now, you said something about the board exam, and this is something I kind of want to touch on. Actually, a friend of mine, he's at McGill, which is a DMD program, and he's 100% son on OMFS. His name's Faraz. So, Faraz, if you're watching, shout out to you for sending this question in. But so Faraz was wondering, so his question is, given the limited number of spots in Canada and the increasing number of programs in the USA who might not be looking at Canadian applicants as much for various reasons, such as visas and whatever it may be, what does the outlook of OMFS look like for a Canadian student? And like, for example, for you, when you're writing your boards, you're studying for it already. Did you ever consider writing the Canadian boards? Would you ever consider working in Canada, putting yourself in a Canadian student's shoes? Would you ever consider working in the US? There's a bunch there, but
Yeah, that's a great question. Some people want to consider like working in, for example, want to consider and working in areas that might have a better financial return, such as in the middle of the Midwest of the United States or somewhere out in the
mhm,
suburbs or, in the middle of a less populated area versus very populated areas, less reimbursement, say from insurance or, higher competition. Similar to the different, yes, I know, but similar to the concept of like you're in Canada wanting to work in the US or in the US wanting to work in Canada, right? Just because it's different licensure, different location. A lot of people want to make it based on that. So now I'm going to take a sidestep and I'm going to say, I think you need to base it on what you want to do. You need to have the self-awareness to say, do I want to say and work around an area where my family's from? Do I want to leave my family and go work in the middle of nowhere and live like a king or a queen? And you can do that. The
mhm,
opportunities are out there and they're available. But I know a lot of people that go out there and they take a residency there, and I know a lot of people that stay there. I know a lot of people that go out there and they come back to their family. I think, and I'm not trying to make it like black and white or blue and red or whatever, but I think this is a stepping stone of a concept to think that what is most important to you. You're going to work for 30 or more or less years, but it's going to be an average of like 30-year career. You're going to want to be excited. Going to want to be happy. And even on those hard days, you're going to want to go see your friends and family, your family, your kids, your wife, your husband, your parents. And you have to have the self-awareness to say like, no, I don't need to. I'm going to go home and live in my mansion on the lake or the ocean with my boat and whatever,
mhm.
right? Or you're going to be like, no, family really is number one thing to me. And even if I am making a half or a fraction of what I would make out in the middle of wherever, I think it'd be really great to come home and or like go see my mom on the weekends, go see my grandfather on the weekend, whatever it may be. And these are just two
Yeah,
solid
yeah.
examples. Moving from the United States to Canada, if you have family there, well, then this isn't like a good comparison for you. But then maybe you're thinking about
Mhm.
more the financial side, or the housing side, or the weather side. The weather in Canada is in Florida,
Yes, yes, yes.
So
It's so cold
there's so
today.
many options, but I think what it comes down to is this is a Gary Vaynerchuk thing is self-awareness.
Mhm.
How do you maximize your day? How do you maximize your lifetime? How do you maximize that 30-year career, whether it be in the office treating patients or in the hospital or at home and seeing family? How are you going to raise those kids? How are you going to maximize your time with your wife or husband? And you got to kind of prioritize what those values are and what they mean to you, and then try and picture ahead, think ahead. How does that relate to your pathway? How do you mold it? It's always going to change, right? How do you guide
Yeah.
your own path in that sense?
Yeah, yeah, absolutely. And just piggybacking off of that, like I remember hearing, for example, getting into dental school, same thing. You go rural Canada, you'll get paid thousands and thousands, hundreds of $1,000 more than if you stayed in more of a busy area. And I almost felt bad about not considering that option because I was like, you know what, family's super important to me. I will 100% always stick around to my family. But I almost felt like I was like shielding off a very ambitious side of me. But there's two sides to every story. I've heard people going just like you said and having a great time and similar things, people going and starting to ask, how was it? Hey, how was it in London, Ontario? Hey, how was it in Toronto? I'm missing that home. So you just got to know yourself and you will. Like it's something that I'm assuming will come to every single person, hopefully, eventually, whether you go through it or not. But it's a long career, right? Like you're going to be doing it for a while. So
Be happy doing it. And then I was
yeah,
just asked this a couple
yeah,
hours ago. Someone was like, "Hey, the loan situation. This is a lot of people's problems, right? What's the loan situation like? How are we going to pay these things back? Should I go into a specialty that might tie me up for another 4 to 6 years, for example, oral surgery, or another long one, maybe prosthodontics, maybe perio, maybe, and potentially have to take on more loans to get through this residency, and it's just going to stack on more hundreds of thousands of dollars. And at the end of the day, it comes back to the same answer. Is that a specialty you're going to be excited with doing every single day for 30 years? You're going to pay that back somehow. The solution will present itself when the time is to come. But right now, you need to figure out what it is you're going to be excited to wake up every single day. What do you have to work 6 days a week? Are you going to be happy doing that? where's that light, that candle burns out fast
Yeah.
when you're doing 6 days a week. Let me tell you, I did it in residency, and it was burning fast as a shooting star.
Yeah, yeah, no, 100%. A professor of mine, he always says, "Listen, you're gonna pay off your loans eventually. You might as well be doing it with something you love." And I couldn't agree more because, like, man, it's you've already worked so hard to get here. Just make sure whatever you choose is something that you're really choosing for you. Because at the end of the day, like, you don't want to be. It's not fair to you, first of all, but sometimes almost equally as important, it's not fair to the patients if you're not really taking it on fully and embracing it and enjoying it. So do that service, do that justice to yourself and to your patients. And that's something I'm also trying to remind myself to do. And to make sure that's something like that's just in the back of my mind always with every decision I make.
And here's
But
another thing. Here's
yeah,
another thing on
yeah,
that topic, and you would appreciate this. Imagine you were that crazy person that did the path that went on and on and on and on, and then you were like you have to say like $2.5 million. By no means am I recommending doing this,
yeah,
but imagine
yeah.
that video you make to say like $2.5 million of lows or whatever. I'm happy because I'm doing the thing I love. Dude, you know how many views that would get, right? And you know how many
Yeah,
people are going to ask you, like, oh my God, is it worth it? Do you actually appreciate it, right? You're going to be the ultimate mentor because you went that hard. You
exactly.
conquered it. Like, that's what this is all about, right? Not I'm saying, but it's about finding what you love and then mentoring others. And dude, that's why I'm glad you started the
Yeah,
podcast finally, because long form content is the ultimate
yeah,
key.
yeah, yeah. And honestly, I wanted to find a way because it was about growing with my content and also, like, hopping off of the trends because, like, sure, like, I'd reached the milestones that let's say that I set for myself, and I was like, "You know what? Like, this podcast, I don't care. If this gets 1 view, if I'm talking to my mom only, hi, mom, then that's fine." At the end of the day, it's gonna be about inviting people who are true mentors and who I wanna learn from and who I hope other people can also learn from because, like, that's what that original podcast is about. It's about learning from people, it's about sharing, and it's about fun, silly questions like the last few I have here
Yeah.
for you.
We got more. Yeah.
Okay.
I was
Yeah, I got some more. Now
You're a
these are
great interviewer,
rapid fire.
man. You
So
gotta keep this going. You're a great
yeah,
interviewer. Now that's where you have the right
well,
mindset. It's perfect. Keep going. Sorry.
yeah, yeah, no. And by the way, if you guys think I'm a great interviewer, check out his podcast. Like, and I saw the back teeth boys. Oh my gosh, those episodes, I love them, and I love the marketing behind them. If you guys don't know what I'm talking about, go search up Dose of Dental podcast, and trust me, you won't. It won't disappoint. And it's the best. Like, who doesn't like a pun, right? So go ahead and check it out, man. Come on, it's a great name. But so now for these quick fire questions, one sentence answers, two sentence answers, like first thing that comes to mind. And then we can elaborate
Sure,
after
sure,
them.
sure.
What would you say is your favorite procedure, whether that's dental, cleft palate, etc., and why?
I would have to say all on X procedures because it's literally life changing. Patient comes in with the barely any teeth, crummy, breaking down, and they leave with teeth they can now smile with at their daughter's soccer game, their son's graduation, their family occasion at the holidays. That interview, love it.
Oh my gosh. Oh my gosh. And if now here's the second one. If you weren't a dentist, and I'll add physician in here as well, what would you be doing right now? Do you think you'd be doing anything different?
Yeah. Yep. I would. And no, I wouldn't be a physician if I wasn't a dentist. I wouldn't do that. It would if money wasn't a problem, I would do music producing. I love producing music to be able to
No
that's
way.
my probably my favorite that podcasting, but also like producing music. I think number one favorite thing.
Wow. And have you produced music? Like, is there some place people can go to check out that music?
Yeah, I have a SoundCloud. I did this in like 2016 and 17, and then I finished one in
Yeah.
like 2018. But since then, I have a friend who does like mixing and mastering, and we completed one this summer. It's like a hip hop drop. It's actually pretty cool. It's like a Rick Ross kind of thing.
Yeah.
But yeah,
Yeah.
it's that's what I would do. I made like 15 or 16 songs, and I just, dude, you need to like, you know how when you lock in to study for an exam, and you like then you look
Yeah.
up and it's like 2 a.m. It's imagine that, but you're like you don't want to get up from studying, but like you gotta like lock in. It takes a lot of time, and it's too bad because
Yeah. Yeah.
you can't really do that on top of dental school easily.
Yeah. 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 And honestly, like there's that just reminded me, by the way, first of all, if you guys know any dental students, chances are if you ask them something like this, they will have this creative niche hobby, such as producing music, which you would never think, but it's that creative mind that goes into dentistry. Just there's actually a medical student. Her name is Cata Fernandez, and she does like DJing and mixing and also running and like a bunch of different things. She's at Ottawa. I think she's like another Figs ambassador. That's how I heard of her. But she loves it, and it's one of those things. I'm assuming that you need something to get you through those long study nights. So I can only imagine I'm gonna need some more mixes. I'm gonna tune in, but I have a feeling I'll need some more during my exams to keep me
What
fueled
about
up.
yours? What's your
Okay.
thing? What would you be doing if it wasn't dentistry?
Honestly, and this is an easy answer for me, I would be a high school teacher.
Really? In what subject?
Like 100%. It's hard to say. I loved physics. I loved physics as a kid, and it's part of the reason why I almost did optometry instead of dentistry. I also loved chemistry, and it was a love-hate relationship because my mom, she was a chemist back home, and so she was like, "It's in your genes. You got to know chemistry." And so that was a tricky one in high school, but after I ended up loving it, and I was honestly disappointed when I thought there was no more chemistry in dental school when it was more bio focused, which made sense. But a chemistry teacher, I could see myself being a gym teacher. Like man, I just think like high school teachers and just teachers in general, like it really takes somebody who really wants to do it, and it really take like it's an amazing job, and like it's one of those jobs. Like there was a few jobs that I was like thinking about at the end of high school. I was like politicians. No, everyone hates politics. You could be the good politician. I was like, no, 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 just take a step back, like, and relax. And then high school teacher or just teacher in general. And my mom pretty much it came down to my mom actually. She said, listen, let's think about how hard something is to do. Obviously, becoming a teacher is hard. She was like, but you need to do more school to become a dentist. Go become a dentist. And if at the end of the day, you really want to do teaching, come back and teach. And she was so right in that. And not in the fact that she deflected me, but more in the fact that now I'm so much more passionate about potentially teaching when I come back to teach in dental school. Like I would love to. And because I hear all the time people complain about certain professors or whatever it may be. And I'm like, man, you would be a great teacher. It takes someone like you, and I just hope sometimes I wish these people would activate and become teachers and speak in all the changes that they're so passionate about. And I'm hoping that I'll have some time to do that near the mid to end of my career, like of dentistry.
Wait, but now you're thinking maybe dental school or high school teacher. I would totally pick high school. Dude, you get summers off.
Yeah,
You get out like
I know,
like 2
right? Come
o'clock.
on.
Oh, man, dude, you're not getting that much time off in dental, teaching dental. So I would go for high
Did I
school, get the benefits.
did I make the wrong decision? Did I make no? I'm just
I was
kidding.
talking to a high school. I took out his wisdom teeth the other day, like a couple weeks ago, and I was like, "Wait, what do you teach? Oh, you
Yeah.
teach geography in high school and social studies in high school." And I was like, "How are the summers?" And he's like, "Oh, dude, best ever, such a hack." And I was like,
Oh my gosh. You're
"The
like,
high school
man,
teacher,
only took this many schools.
dude." Everyone's like, "Oh, you don't make that much. You get the whole summer off."
Yeah, what do you mean? And also, it's like so fulfilling. Probably like I love visiting my high school and coming back and like seeing the teachers who really made a change, and I like being that person for somebody. Man, I'm sure it would be great. Okay, now I have three more questions here for you, and we'll quickly go through them because by the way, thank you so much for joining me at the end of a
Thanks for
super long day, and it's helping me honestly decompress after my long day as well. So this is
dude,
huge.
whatever you need. We
Now
chat.
we'll
We could
jump in.
chat about anything you want. I'm open book, pretty transparent, and it's cool to go through these scenarios because now I'm thinking like, can I
Yeah.
file to my high school for a job? With St. Anthony's taken?
Are you guys hiring? It's just Brennan from the class of yeah, just
2012.
yeah.
2012, we got any openings next year? Come on. If anyone drops out, let me know. Teach the kids.
Yeah, no. Yeah, absolutely, absolutely. Okay, so this question is now something about your passion, OMFS. What is a common myth or just something that you think is misunderstood about OMFS that just drives you nuts?
What are some of the other specialists pushing these that were
Yeah,
hacks? Someone told me this the other day, like, did you
yeah,
hear that so and so they're calling the oral surgeons hacks? So you want to go to the and it's really not true. You know, I think you could look at any specialty, you could look at any profession. Personality is a personality. It can be good, it can be bad, it can be kind, it can be harsh or cruel, and you can't judge a specialty based on one or two or three people's personalities, you know? I can say the same thing about other specialties, you know? It's like you don't vibe with
mhm,
someone and all of a sudden they become like the worst person in the world too, and That's not it. So that's one of the misnomers. Another thing is there's so many different avenues because oral surgery, it really is the bridge between medicine and dentistry. There's so many avenues that you can take. I mean, you could go on to be a head and neck cancer surgeon, taking cancer out of patients, you know. I want to find a way that they get more support. Just side note. But there's so many things you could teach. You could work in a hospital. You could work in a clinic. You can work in a school. You can work at the VA hospital. There's so many different avenues. You could be corporate. You could be private. You can be family oriented. You could work in a family dentist office as the surgeon. You could work in a solely or there's so many avenues, there's so many opportunities, and I think it's one of the top that you know the most, like from point A to Z, you know the most of dentistry in between, right? Because you might not remember what like the gingival sulcus length, the biological width is 2.8 through whatever the hell it is. But like, you know, the things that matter when the airway gets tight and a patient's suffocating, the oral surgeon can step in and do you know, if they're, and I just think that's such a beautiful thing.
Yeah, yeah, no, absolutely. I honestly want to like, I remember just like any other dental student that, and I'm sure it's like this at other dental schools. The consensus is if you want to specialize specifically in OMFS, it's usually just gunners, people who will like cut your legs to get ahead, this, that, and the next. And I fell to that trap of believing that for the first few months. And then you meet the first OMFS teacher. And then you meet the first person who said they were interested in OMFS. And they are the most genuine, nice people of all time. Like, and I know pretty confidently now, probably, or I guess not too confidently at all yet, that I probably don't want to specialize. But I think people forget how hard they tried to get into dental school. And then when they're in dental school, they're like, oh, I don't know. So you're gunning, you're trying too hard. Man, we all tried so hard to get into this
Yeah.
school. So somebody being so passionate and eager and motivated by this cause, this vocation of theirs, like it's something I find inspiring and I hope to find in my own lane soon enough. But like trust me, like Dr. Lovell at our school, Dr. Shimzu, these are like some of the most, first of all, funny and amazing people and amazing professors. And that goes for every single other professor in every single specialty. There's anecdotes for bad things everywhere. You just want to make sure that you're kind of taking the experience for yourself and trying not to let those preconceived notions affect you because at the end of the day it's your life, right? You're not running by those rules.
Right. Break the rules. Break the rules. Be a good person. Study really hard,
Exactly.
right? The
Yeah.
biggest thing I tell people that I mentor, I'm like, sure, you want to come from that everyone's spot, yada yada, but be a teammate. Don't compromise your personality. Don't compromise being a team player because you think that's going to give you a couple more points and it's going to take away some of their points. I see this more often with people who just go from school to school to school, never took a gap year, never worked in that summer or went away for the sleepaway camp. It's like, I get it, you know, and you haven't been exposed to certain things that much, but you need to recognize that this is a team sport. Dentistry is a team sport. That's why we have different specialties. That's why we're taking care of patients. That's why we're referring in and out and collaborating cases together. And that's what it comes down to, you know, and it starts at the dental school level. So if you are a faculty member, remember to support your students in this way. You need to instill teamwork. And if you're a student, remember, find that study group. They're like a family to you through dental school, and you rely on them and they rely on you. So think about that. That other person that you might not know could be a family member to one of your friends, you know? Like literally like a dental school, you
Yeah.
would die for them because they studied with you all night that one time and then months and you get it. You get it. You know what I'm talking about.
Yeah, yeah, and it's just one like you guys will all see for yourselves eventually. It's one of those things that I think just you just come to learn. And once again, that I'm still grasping with. Like I don't want to pretend like I know it all or have experience at all. It's just it's something that was 100% a surprise to me, and that I definitely didn't appreciate, and have come now to more like appreciate 10 times more. Okay. Last fun question for you. This one will end on kind of like a fun note. Like I want to hear a story if you're able to share. What is the wildest thing that's ever happened mid-surgery to you at work, at residency, anywhere?
I got a couple. Today I got hit in the forehead
Yeah.
right here by the piece of it was half the tooth came shooting up. The other went into the window across, and the window's like 7, 8 feet away. I don't know, the space right in the right here. Another one, let's see. Another one was we were dissecting down the mentalis right over here, and there was a labial artery it was a mandible fracture in the front. We were dissecting down, and there was this attending that never really treated me good. And no, so I didn't do anything, but we're dissecting down, and it was one of the arteries right over here. It went right through it, and the artery kind of shoots up like this and just,
My god.
and
Oh my gosh.
whoops, let me put a finger on that. Hold on. That's a funny one.
And that was by accident?
Dope
Was that a
accident. You don't always see these
just making
crazy
sure.
stuff. Yeah, yeah.
Just
Oh man,
yeah,
no,
yeah.
there are a lot of stories.
Yeah, yeah.
Another one. So here's a fun one, or not a fun one, not fun at the time. In oral surgery, we do there's all
Mhm.
service rotations. So you'll be on hand surgery, plastic surgery. You'll be in bariatric surgery doing the stomachs. You'll be on some programs they have ENT. Another one, you're in the ICU. You're doing a rotation ICU. You're an ICU resident now, and like you just graduated dental school, but now you're an ICU resident now. Another one is the rectal clinic. Sometimes you have to go and look at buttholes, and I've co-residents. I don't know. I wiggled my way out of this, but some of these my co-residents, they're hitting world record numbers of of dentists that have had to do prostate exams. Fingering the buttholes, and that's
That
something
is
you
that
don't
is
expect, right?
no,
So all of a
no.
sudden, like,
Oh my gosh.
I'm looking at these like people's rectums. My co-residents had to get in there. Oh, anyway, you want to hear a
That is
joke?
crazy.
Yeah,
Yeah, this is okay, listen, I did not sign up for this, just for the record. So if any future professors or anybody, I am not game. This is because this is, by the way, the same time I saw a full body dissected for like an anatomy bell ringer, and I was identifying like everything from genitalia to brain and I was like, please, please, guys, if somebody comes to me complaining about their genitalia in a dental office, I am going to refer them 1,000,000%. Please do not. But anyways,
one
that's
ambulance.
neither here nor there. Yeah.
Here's even funnier. After one of those days in rectal clinic, that was at the point like early. It was like my just started first month into second year of residency, and that was kind of when I was trying to do like videos, like so today I learned this and that, and I put up the video. This was my first TikTok account. It got banned in 2 hours. The reason it got banned, it was literally after rectal clinic. So I left for the day. I was like, guys, if you haven't heard of a rectal prolapse, this is what it is. And I put up like a Wikipedia. This is like, you Google this. This isn't censored. It comes up. And I was like, this is a rectal prolapse. It's from this and this. This is how you treat it. Yada, yada. This is what I saw today in rectal clinic. And I'm an oral surgery resident. Within 2.5 hours, TikTok, you have been shut down. And so like going into say, then I just started a new one 3 months later. But anyway, so funny stories.
Yeah, no, awesome, awesome. Well, that's a wrap for today's episode of Moony Talks. Huge thank you to Dr. Gallagher for
Go
joining and
invited. Go
sharing his
invited.
story. Dr. Yeah, of course. I just want to make sure like people like you worked hard for that degree. So yeah, no, huge thanks to Brendan, and make sure to follow him. I'll drop his handle. He's partnered on Students of Dentistry, Pre-Dentalship Map, so many things. So this description will be quite long. And kudos to you, Brendan, for all the work you do in dentistry. Seriously, if you guys have made it this far, first off, thank you. It means a lot. If you enjoyed this one, make sure to follow wherever you're listening. Drop a quick rating or review. Share it with someone who you think would vibe with the conversation. And you can always just keep up with me over the Instagram, TikTok, Moony.Dentistry. And of course, if there's a topic or guest you'd love to hear on the show, even you, Brendan, if you have an idea for where this could go next, please shoot me a message. Until next time, stay curious, stay kind, and keep the conversation going. Brendan, thank you so much.
Thank you, man. Thank you. Congratulations on starting the podcast, and just go for it, dude. Keep in touch on the DM here, because this is how anything. Just shoot something
Absolutely.
back. I can respond on the audio. It's quick, detailed, and
Yeah. Yeah.
just make content, dude. We have to have. This is part 2. Let's have a part 3. Come on in a couple
Yeah.
months. Let's chat,
Yeah,
dude.
absolutely. Absolutely.
Yeah.
And just so you guys know, I texted Brennan literally like 3 or a day ago or something, and Brennan responded and he hopped on. Like, this is literally, shoot him a message. Make sure you guys keep up with him. He's literally the most, like, I can't say enough good things, man, because you're honestly, you've supported me so much.
You're
So,
very kind.
and I will continue. We have to
And
stay
you
in
too,
touch.
man. You too, brother. We'll
Absolutely.
talk. All right.
Okay. All right. Take care,
All
Brennan.
right, man. We'll chat soon.